this is being recorded, so I know that it's supposed to be sent out after this. Um, so for those that missed, or those that's, if you're coming in a little bit later on, then those can pick up and listen to the full recording when it's sent out to you. So I want to thank you for being here. I really appreciate the time that you're stopping during your day to come and listen and find out a little bit more about medical coding. Most of all, I hope that each one of you and your family are healthy and that everything is going well for you. I want to start off by telling you that there is a place to ask questions, because on your end, you're not verbal, but you'll see a Q&A, kind of a little chat box. So if you will, as I'm talking, or as you think of things, please send me a question, and know that I'm going to address all the questions at the end, instead of in between. That way, if someone needs to go, they can leave, because I want to respect your time. That's very valuable, and so we'll answer the Q&As at the end. So once again, there's a Q&A down there. So please utilize that for your questions, and don't hesitate to ask a question. There's no wrong questions when it comes to a new career and when it comes to medical coding. So I want to first tell you who I am, so you get some kind of comfort level listening to this webinar. My name is Faye Kelly, and I have been in medical coding for over 40 years. I started, right out of high school, working in our local hospital, and as a medical records clerk. So back in the day, it was called medical records. It's now called health information management. So if I mix up those terms every now and then, you'll know they're the same thing. But I was so very fortunate. I was given a code book very, very soon after I was hired. And back then, the code books were, I was going to get a code book to show you, but they were this big, and now they're this big. So, diagnosis and procedures have only grown, and the specificity that you can give to a code. But anyway, I started, the director was leaving, the hospital offered to pay my tuition to get my degree in health information management. Back then, you didn't really have credentials in coding. You actually learned how to code through the health information technology program. And so I was blessed with that. I became an HIM director, and I was an HIM director for 38 years. My first hospital, I was there 24 years. And then I moved up the road about an hour north, not physically moved, but transitioned my career to a larger hospital, and I was there as HIM director for 14 years. Always loving the coding, always enjoying that piece of it, and realizing the value that it brings to the healthcare industry. So that's what we want to talk about today, is whether this is kind of where you're at and what you're thinking about. A lot of people don't know what medical coding is. So give me just a minute to make sure that everyone understands what medical coding is as we move forward. When you visit a physician, a clinic, and to have an x-ray, if you injured your foot or arm or whatever, whenever you make a medical healthcare visit, that diagnosis and that procedure that the physician assigns to you is coded using a selected code for your diagnosis and your procedure. Now that code is important because it drives the revenue. So if you code incorrectly, then the provider, no matter who it is, the physician or the hospital or the clinic or whoever, they're not going to get a proper reimbursement. So it's critical to me that we educate our coders so that when you're in the workforce, that you are an expert. All right. So that's especially right now, think about what all's going on with COVID-19 and how it has affected coding. Um, I, I keep up with a lot of it. Not being in the hospital, I probably don't keep up with as much as I would if I was sitting behind a desk there. But I have kept up with it, and because I've got to know what the codes are. I've got to know what um, CDC is doing, and I've got to understand the billing part for COVID. So when you think about it, we had a code for the coronavirus. We already had that, but this is a different strain. So we didn't have a code in our code books for COVID-19, but we do now. And it's not in our code books, but it's been issued by the government so that healthcare professionals can bill and get proper reimbursement. They've originated codes for testing. They've originated code for suspicious symptoms. I made some notes last night. It's just, you know, if a patient comes in with COVID-19 and there are symptoms that follow along with that they're experiencing, it's important that the coder captures all those symptoms. All right, and let's think about why this is important. First of all, I've already addressed reimbursement, but I want to address the statistical side of coding, which is always been, the reimbursement is energetic because you really involved in selecting right down to the sputum culture when you're putting a code on a chart for pneumonia of a patient. Do they have Klebsiella pneumonia? I mean, you don't just code pneumonia, you break it down. You're very specific. Neoplasms, cancer. Think about that. How important those codes are. And I just want to just touch a little bit there because geographically, these codes are captured and they're reviewed. So the way pancreatic cancer being treated in South Georgia is statistically compared to other parts of the country, and the success rate is also compared through quality improvement programs. So you're capturing the codes, the specific codes of exactly what type of cancer it is and where it is located. And it comes together, and those at the very top drill down and see the success rate here compared to the not so successful over here and compare treatment protocols. So that all starts with the coding. It is just, there's so much value in a coder. And if you don't take away anything else, take away the value of that career because it is very valuable. And it has emerged through time in the industry where that value is seen. And you can tell that in the pay, in a coder's pay. You can tell that. It's no longer at the bottom. And it has the potential to grow exponentially considering whatever you want to do with your career. So I wanted to talk about COVID and what it does. And then I want to talk about learning to code and exactly what that entails, because I want you to be careful. Whether you choose CareerWize or whether you choose anyone, there are some basic fundamentals that you need to be aware of. And of course, I'm going to show you what we have or tell you what we have here. But the broad scope of the concept of medical coding is what I want to talk about that you need to make sure that you're going to learn. And I kind of wrote down some notes because I can get I can get kind of, I love to chat and I love to talk about coding. So I wanted to stay focused for your benefit today. So when I'm talking about the basic fundamentals, I want you to make sure you get your terminology, make sure you get your anatomy and your pharmacology. We've got those courses in our course. Now, there are some coding per se boot camps where you can go and you can get everything in a few days. I just want you to be leery of those, and I want you to pay attention, and I want you to make sure that everything we're talking about today that you're going to get, because it's like I said, the fundamentals is important. Then the coding piece and how you learn it, and then the one-on-one. So we're going to talk about all that, and I kind of want to get into what our course is now, and how it's written. It's actually written for someone who has no medical coding experience and no healthcare experience. But yet at the same time, I love the feedback I get from nurses. I have nurses, I have pharmacy techs now, I have CNAs, I have billers that already have, especially the really healthcare where you're getting into, the nurses. I love their feedback, because this is what I had hoped they would say, but what they tell me is it's a good refresher, and it's not so extensive that you're spending an unsurmountable amount of time drilling down, because we didn't develop this so you could be a nurse or a physician. We developed this so you could be a coder, so that you could learn the highlights of all that, of the terminology, of the anatomy, of the pharmacology. We developed that so that you can learn it in here, and you can remember some of it in your own personal life, plus as you're coding. So we take that, and then our other chapters, and I'm gonna pull up and do a share screen and let you look at our course. But we talk about health data management in our course. So I want to tell you what that is. And that is actually talking about billing. We're looking at billing. We don't drill down in billing, and I'll tell you why. Every state payer has a different guideline. So if you can learn the fundamentals, the very basics of billing, if your career lands you in a job that is coding and billing, then you're going to know how to bill. What you've got to learn, no matter where you go, is what these payer guidelines are. And that's what your coding manager / office manager will give you is here. This is what Blue Cross Blue Shield for the state of Wisconsin, Michigan, Florida, Georgia. They've got their own rules. Medicaid has their own rules. Private payers. So what I want you to know is the fundamentals of billing. I want you to know the terms. I don't want anything to be Greek to you when you're put into that position, but more than likely, your position is going to be more so of a coding, assigning those codes, those diagnosis and procedure codes, to get those claims out, because it starts with the coder. You're going to enter the codes into the software system for the hospital or clinic or whoever. You're going to enter those codes. The biller is going to drop it. It's going to go through a process of what they call clean scrubbing, or scrubbing so the bills are clean. And any questions on the coding come back to the coder. They don't go back to the biller. If something didn't get paid, they're coming to you. You've got to be able to go through that chart and say, well, this is why this is coded. So health data management covers the billing, covers HIPAA, your electronic health records, all the terminology that's needed for you to be able to sit at your desk or in an office and understand the terms that are coming across to you from billers, from payers, and from your coding managers. Next, we get into the ICD-10 CM, which is your diagnosis coding. All right, so we teach that. We teach, then we get into our CPT and our HCPCS. Those are procedural coding. At the end of that, we have a CPC prep. That's a national exam. You're not going to find an employer that's going to hire you unless you've got training with a credential. Now, if you're working toward your credential, I do know there are a couple of facilities that I've spoken with our students with just recently, that as long as you've been through the course, they're willing to hire you if you can pass their pre-hire test, but they're expecting you to get certified within a certain period of time. So basically, to get started in this career, what you need to do up front is to learn medical coding and to get those credentials. I'm going to do the screen share now, I hope. Let me drag this over. All right. Can someone shoot me a yes or a no if you can, or Shurston, if you can just text me, can you see the CareerWize screen? Oh, we see your screen. Thank you. Thank you. All right, so what I want you to pay attention to, and I'd like for you to write this down, is our website, which is www.careerwize, spell that with a Z.com. All right, so I want you to go and make a note of where to find us. And what I want to show you on the very first page, first of all, I'd like to invite every one of you to go through each of these tabs and get to know us and a little bit more about our program, a little bit more about our students and some of their history and what they've been able to do with this career. But I want to scroll down to the very bottom because I think this is the page. I sure hope so. I'm looking for our demo. There we go. I didn't scroll down far enough. So you can see from that scroll, just keep scrolling. But this is important to me that you see this because our program is written like no other. You're just not going to find this out there on the market, and you might eventually, but not today. And that's what I want to show you. When you enroll into our program, it's 24/7. All right, so you are able to start immediately. If you enroll tomorrow, you start tomorrow. Okay, so it's work at your own pace, and we're going to talk about the two different programs later. But I first want to show you what you can expect in our program. And I'm going to kind of skim through all this, but I'd like for you to go back and read it, because what I'm trying to get to is a sample page. All right, this is an example. This is in our medical terminology. So I want you just to look at how the page is set up. First of all, we're learning prefixes. And so we're going to learn hepato. And then we're going to give an example. And then it's going to be, what do you think the combining form means? Well, I'm just going to click on one. Nope, try again. I'll click on another one, and then I'll click on it till I get it right. All right, so then what do you think hepatitis means? And you're kind of thinking about it to yourself. Let's say, let's just say low blood pressure. Because here's what I want you to see. I can retake it. Everything in our course, all of it, this is a game. We're not going to do our game, but it is super cool. Um, Everything in our course, these dragon responses, you can retake. So let me tell you about this. I get an opportunity to retake. So when you're first going through the course and you're in the medical terminology and you're in the anatomy and you're in the pharmacology, those first sections, before you get to help data management, take very little notes, all right? Because first of all, you're not going to remember all this. There is just no way you're going to have that kind of memory. The purpose of these tests, these games in our system, these flashcards, the purpose of all this is to help you retain. And how you retain is if you don't get them all right, you take it again. And you repetitively take it again, and you will be amazed at what your mind can retain just from the repetition of going through the little quizzes, the little games and everything that we have. This is one of the first pages in our ICD-10 diagnosis course. You can see, I mean, it is broken down, very simple and very easy to understand, and then you apply it. So basically you're reading at the top, you're applying at the bottom, and sometimes you're applying in the middle and reading a little bit more, and then applying again. Now this doesn't show it, but on every page in our course, every page is a comment section at the bottom, not contact support. That's if you have technical issues or, something's not working technically. The comment section that you'll find down here at the bottom of every page is for you. There is no reason to struggle through this course. You're going to put your question in that comment, and student support is going to get back with you. All right, there's no hesitation. You ask the questions. That's what we're here for. When you get into the coding, I tell my students, don't struggle, because if you're struggling right now in grasping a guideline, and we cover every guideline in our code book, if you're grasping while you're in it, you're not going to get it, and it's going to stay with you on through the end of the course. Let's get a hold of it now. Let's look at it now. Put a comment down here. All right. Every enrollee has my personal cell phone number. I do several, and I've done several lately one-on-ones, because that's important to me. If you're not getting it just through Q&A, comment, questions, and then our answers, then we need to talk. I'll talk to you up until 10, 11 o'clock at night. Then I'm going to cut it off, because that's about as long as I can last for a day. But a lot of my students work, and I have young moms, so they're trying to get their kids to bed. So the time that they can do a one-on-one is after that time. So I do the one-on-one, and I love it. I think that's one thing that I love about our course, is that I can freely give to you the blessings that was given to me 40 years ago by someone being in my corner. I have been so blessed to have someone that just encouraged me and stayed after me at some points, because we all go, oh, I can't do this, but you can. And so, I'm going to tell you to buckle up and let's get it done, because if you start this and this is what you want to do, you can do it. And myself and others, we're here for you. But it's important to me that you see our course, and that you see the the actual learning process, because I fell in love with this when it was created. And I definitely believe you will as well. Um, I'm going to go back, and I just wanted to make it easy because I wanted to go into our um, to payment plans. That's also important. I want to talk about our students too while I'm just kind of scrolling here, who our students are, and you would just be amazed. I do have several nurses. I have nurses that just are looking at retirement. They have two of them have travel jobs, and they actually want to go remote, stay home, and work in the latter part, getting ready for them to retire. And then when they retire, they want to continue to do it. So I have nurses, I have pharmacy techs, I have teachers, I have several students between 55 and 65 who are looking for extra income. And this is a great supplier for full-time and or part-time, because you would be amazed at how many part-time coding jobs there really are. It's a lot easier to fill a full-time position, so resources don't find it as easy to fill a part-time position. So we have and then then I have bless her, 72-year-old. I am so proud of her. She is awesome. She is killing this course. She's been in it just a couple of months, and she's 42% of the way. She is a retired respiratory therapist, living in the big city area, not wanting to commute anymore. She wanted to learn coding, learn a little bit about the billing, and open her own business. Yes, I did say 72, just in case you wanted to make sure that you heard correctly. Is that not awesome? That's me. That's what I want to be. So I don't want to be starting a new career, because I'm absolutely passionate about what I do, but I'm not giving up this for a very long time. Now let's talk about our program. We have two payment plans here. We have, first of all, we have the $247 a month. That is everything you need. Now, we do not furnish code books, okay? You can find code books a lot cheaper than we can supply them from our suppliers. Most of my students in the past few, well, almost a year now, wow, they're going on to Amazon, okay? So you would need to purchase books and it's usually around 2 to 4 months, because think about this. You've got to get through your basic coding industry class that we teach. It's just to kind of give you a background. That doesn't take long. But then you've got to get through medical terminology. You've got to get through pharmacology, anatomy. You've got to get through all those. So, this is work at your own pace. It could be 6 months, but the average is 2 to 4 months that you will need to purchase code books. Okay, so I want to say that up front. This $247 a month also is a great deal for refreshing. For those of you that have already had the anatomy, already had the pharmacology, and you didn't get your credentials, and you want to get your credentials now for coding, then you can pick up this course at $247 a month. I'm going to encourage you to start with the health data management, because if you've been out of it long enough, then you need a refresher on billing and HIPAA and EHR and so forth. And plus, some of that is on the national exam. So you need that, okay? So the other piece of that, you see, you can cancel anytime. And what I want to say about that is this is great when life throws us some speed bumps or big hurdles. Let's say you've been in it 5 months and you just can't make the payment for the next month. Well, you're going to call me and we're going to deactivate and reactivate when you're ready to jump back in. So that is brand new. That is something that we just started doing. I'm proud to say there is not another subscription program. And, we listen to our students. We saw life hurdles going on, and I cannot thank the co-founders enough for putting into their mind and putting into perspective a program like that. This does not include the virtual internship, which we are going to talk about now. The virtual internship is actual medical records that we de-identified all patient information. So there's no HIPAA violation. There's no privacy violation. That is where when you finish the course, you've gotten those credentials or you're scheduled to take your credential and you can start in the virtual internship. What happens is you move from course mode to real life mode. So yesterday you were kind of being prompted on how to find everything. And then today you're like, okay, here's 50 orthopedic charts I have to code today. And that's all it is, it's charts. So what do I do? It's just so real life, and it's a value. It's a value to you, and it's a value to your employer, because this is where I have no problem calling a hiring manager and saying that Heather, using one of my daughters as an example, Heather actually has been through our program. She did phenomenal. She got to the virtual internship. Let me tell you a little bit about what that is. And she did a 95% accuracy rate and spent close to 100 hours in it. And that's what we need for you to do. That's the other piece of virtual internship. You've got to nail that 95% consistent accuracy rate, all right? And you're wondering, oh, why? Because that's national standard. So on your resume, we can certainly include that as we work with you to, spruce up your resume. That can be included, all right? So think about, even with this right here, when it's all said and done and you've got those credentials and you went through the coding and you still are going to be looking for a job. Sometimes my students that take this, they've already got a job and they just want to transition over to the coding department. So they're going to take this and just learn the coding. You don't need the virtual internship possibly, unless your employer encourages you to take it so you get real life value there. But if you want to purchase the program that includes the entire course plus the virtual internship and the graduate support package, where we actually have research going on finding and locating job assistance for you. Now at the same time, I'm not guaranteeing anybody a job. I'm not even sure that I've said this, but I'm saying it now because I can't promise that. But what I can promise is that we have resources, and we're blessed to have resources, and we will reach out to those resources, and then we will do our best to get you interviews. At the same time, I want you out there looking too, because the group concerted effort of putting your momentum forward and our momentum forward is all about getting you that job. That's why I tell my students, I am with you from the day you enroll to the day you start that first job, no matter how long we have to hunt. Hopefully we don't have to hunt that long. Medical coding is the booming industry. One of the top 10, I believe, picked by the U.S. Labor Bureau of Statistics, Bureau of Labor Statistics. I think it's 14 to 16% growth through 2026. So wow, this is the growing industry. So coming back to that again, it is all this for $23.97. Now I am going to say that for anyone that enrolls, and you're listening, so this applies to you all. anyone that enrolls by midnight, April the 30th, it's going to be $21.97. So I would like for you to contact me. I'm going to give you all my contact information, and I'm going to tell you how to find me, how to reach out to me, so that I can give you the coupon code for that, because I don't have that created at this time. I wanted to present that offer, $200 off, by end of midnight on April the 30th. So I'll get that coupon created, or I won't, but IT will, and I'll have that available for you all. So it'll be $21.97, and you have the program for 1 year. How long does it take to complete it? It's probably another question that you're thinking. The average student is probably around 9-10 months. Okay, so if you're taking 9 to 10 months into the coding program, then you're going to take a good 2 months to get your 100 hours into the virtual internship. That's the typical student spending 1 year. All right, so that's pretty much, and that's a savings if you multiply 247 out by 12, and you come up with $21.97 instead of $23.97. It's also a savings, but it depends on your need. It depends on, do you need the virtual internship? Are you just needing a refresher? What are you needing? So all right. Let's see if I have anything else on my notes that I might not have discussed. With you all. I want to stop sharing, and I'm just going to come back to me so that I can see any Q&As. I believe I have covered everything that that I hope gives you some type of comfort level of what medical coding is, and whether or not it's a fit for you, if it's something that you want to think about and something that you want to do. My contact information, I'm going to give you my email. So I hope you have a pen and paper. It's Faye, F-A-Y-E dot Kelly, K-E-L-L-Y, at CareerWize.com. All right. So you can email me. I never remember our toll-free number, and I said I was going to write it down, and I did not. So I'm going to get you our toll-free number, and then I want you to feel free to call this number. Honestly, 9 times out of 10, I answer it. But if I don't, leave a voicemail, or if you do talk to someone else, you just give them your name and number, and I'll call you back. But our toll-free number is 888-949-3225. Okay, so that's pretty much how you can get in touch with me. And remember, our web address is www.careerwize, spell that W-I-Z-E.com. Oh, thank you, Shurston. I said the last time we did a webinar, it's only our second one. Well, the first one was just to our students. That's the other thing, is we're doing webinars now to our students at least once a month, twice a month if info is needed. It is, it's just putting us, maybe some nights 7 can come, maybe some nights 50 can come, but it's about getting together, and we're, Shurston is working on so that we'll have like a video chat, like everybody can actually speak and you can hear everyone. So I want to think of students as a family body, and I want, in coding, the resources, the that I have made, the my peers, the friends I've made through organizational meetings, through just outside companies and so forth, having that someone that you can call, because you're going to always have coding questions. You're not going to ever know it all. So just to pick up the phone and say, hey, I call Eve. That's one of my best friends. I'll call her and I'll say, I'm not sure about this code, help me. You're going to experience that. And especially for those that's wanting to work remote. And I'm going to tell you, I think COVID-19 is going to change the game. When I left the hospital 7 years ago this summer, we were already considering transitioning coders home. And I think that coders have proven that they can work from home now. So we're going to see that happening, and the opportunity for coders to be remote is going to be even greater than it already is. Most of the companies that we work with hire remote. So no matter where you're located, you can be coding for a company across the US. So remote doesn't mean you code for just in your area. It means you're open, because your credentials, the credentials that you get, are national. So they are good in every state. I've had questions before. Was the credentials just good for the state that she resided in? And I'm like, no, once you get those credentials, you can go to work in Alaska. You're fine. It's just awesome. It's awesome. Coding career, maybe you want to grow as a coder. Think about what all you can be and do. Think about specialty coding. Think about auditing. Think about consulting. Think outside the box. I encourage my students to do that. I work very closely with my students that reach out to me. Some students go through this course and they go through, they get their jobs, and they're just phenomenal out there. Others go through and we connect, and I personally enjoy that. So I have no problem when you do come on board, you will have my personal cell phone number and you will know that I'm available. So let me see if I have any questions. I'm gonna I don't have any right now, so I'm going to open up and say, do you have any questions? Because that's pretty much all I have today. I wanted to certainly show you our program, which I did. I want you to go to our website. I want you to browse around. I want you to call me, email me with questions. Let's see if this is the right career for you. And I will tell you, it's not for everybody. But if it's for you and you're thinking it is, then I would love to help you make that decision. Let's see. Does anyone have any questions before I kind of shut us down here? Listen, and I also want to thank you for coming. I want to thank you for your time that you've put into listening to me this afternoon. And if you've got Facebook and you haven't liked our page, please go on there and like our page. And the reason I say that is because that's how you see our updates, see our new webinars, see what's going on, see anything in the future that we need to share with the coding industry. So please like our Facebook. I think I just want to look. Is there a payment plan on the option with internship? Yes, absolutely. You can purchase the $247 a month, and when you're finished with that, then you can pick up the virtual internship. Okay, and so that just carries on. Let me look right here. The virtual internship right now is at, I know it's less than $200 a month. So I can tell you that. Nicole, if you want detail, if you want to know more, if you want an exact, if you'll send me an email, I'll send you back an email, because I should have had that out. But I do know that it is less than 200. But what you would need to do is to enroll in the $247 a month, and then we'll need to get you ready for that national. It's $167 a month. $167 a month for the virtual internship. Thank you, Shurston. So we need to get those credentials behind your name. That's our first goal. All right. And then we'll walk through the virtual internship. I'll get you, all you'll do is just, we'll be talking by that time because you're taking the national exam, and I want to help you get it scheduled and everything. So, and then we'll decide the right time to put you into the virtual internship. If you're having to wait too long to get your, to take your national exam, then we'll go ahead and just say, hey, let's start the virtual internship. I don't want to waste a lot of time because it's your career on hold. So I like to kind of move pretty fast. And RN, awesome. I've got several of those. All right, let's see if there's anything else. I'm going to keep it open one more minute. I think the thing about it is don't hesitate to reach out to faye.kelly@careerwize.com with your questions. All right. I always hate to shut it down because somebody might ask something, but we're about to close down. Listen. Okay, everybody. Have a good rest of today. Stay healthy, and know that we're here for you to get started at whatever time you're ready to get started. We're here. Our program is 24/7. You can enroll. You don't need me to enroll. I just want you to go in there and look at our website and see who we are, and see the passion behind why we have CareerWize, and how much we care, and how much we appreciate you, each one of our students, and work hard to make sure, like I said, we're there from start to finish. We want to make sure you get that job. All right, so thank you. Stay healthy and be blessed.